Dr. Jill Waibel, thank you so much for joining me today. It's wonderful to have you here in Paris.
Well, thanks for having me.
So, for those who are new to IMCAS and the IMCAS community, who are you and what do you specialize in?
I am a board-certified dermatologist from Miami, Florida. I am a laser expert. I own 90 lasers, and I really do anything laser, but I pioneered the technique using fractional lasers on scars and especially on burn and trauma patients. But if it could be done with a laser, we're usually doing it. I do about 40 to 50 cases a day for the past 20 years. That's a lot of lasers. They're amazing. The lasers are amazing.
So, how did you get into this subspecialty of your specialty?
So I don't want to bore you too much, but when I was in medical school, I wanted to be a surgeon because in med school, there's either you go a medical route or a surgical route. When I saw surgery, that you could fix someone. It wasn't you were just giving meds. You do rotations, and the chair of surgery, you have to sort of be in his good graces. So mine was Dr. Turk, and he was an Army surgeon. And you would wake up at 3 every day and work all day and all night. This was before there were hours. And I did this for 11 weeks. And on the 11th week, he said to me, "You should be a dermatologist." And I was so mad. I was like, "Are you kidding me? I want to be a surgeon." But it was a compliment. He thought I had good hands and a lot of knowledge. So he said, "I want you to go see Dr. Haney on Monday morning at University of Cincinnati." And I went, and Dr. Haney's like, "We're going to be lasering children with birthmarks." And this was in the 1990, early 2000s. And once I saw the laser being used, I'm like, that's what I'm going to do. So I was very blessed. And from that moment on, I became all laser all the time. And I was in the right place at the right time because when I emerged, I treated like 40 patients with laser my first day on my job. And I was able to go through the laser world as the lasers came out. So there's a generation above me that were the first, Rox Anderson and Roy Geronimus, and they really just, were the first physicians in the world to use a laser. And I was kind of in that second group. And so through the last 20, 30 years, every time a laser came out, I was able to help develop it, work with the engineers, work with the CEOs. I was very lucky. Right time, right place.
So, was it a bit of an early humanitarian calling that got you into it? Was it because you were really invested with the work you were doing with the children, or was it something else?
No, I think it was for me when I saw that you could remove a birthmark off of a baby that otherwise would have been there that child's whole life, and they would have been bullied and stigmatized. And then I had a patient my first year out of residency that came to me with terrible burn scars on her face, and she's like, "You are going to fix me." And I was like, "I am going to fix you," because she's like, "I don't want to embarrass my family every time we go to the grocery." And at that time, lasers weren't being used on scar patients because the ablative lasers actually made scars worse. And I didn't know that. It was a little bit of, I'm very spiritual. And at that time, the Fraxel laser, non-ablative, had come out, and I had tried a few things on her and nothing was working. I did the Fraxel and it melted away, like to zero. One thing led to another. Now I'm lecturing all over the world. I'm doing clinical trials. Then I got to help develop the fractional ablative CO2, and I was the first one, again, to treat a burn and trauma patient. And I've worked a lot with militaries around the world. I've lectured in most all the continents, and if there's, something very sad, like 5 years ago, Taiwan had a fire at a concert, and myself and a couple colleagues went to Taiwan to help treat the burn survivors with the lasers and train their doctors. So it's been an honor to be part of this laser revolution, really.
So, what are some of the recent technical advancements seen for scar treatment, and how have they impacted clinical practice and humanitarian efforts?
Really, lasers are now considered gold standard for a scar. So it doesn't matter if it's an acne scar, a surgical scar, a traumatic scar, lasers are first line. Really, it's an access problem. Not everywhere in the world do we have lasers, but advances in laser technology, I would say that, for example, the luminous ultrapulse, we were able to work with their engineers, and it now goes down to 4 millimeters in depth because many scars are very thick. So the earlier ablative fractional lasers only went down, 1,000 micrometers or 1,200 micrometers, and we really need greater depth. The other great advance, I think, and I've done a lot of work with this, is using optical coherence tomography, where you can actually image the depth of the scar, and then you can tune your laser to that level. Another advance that actually happened for me, I was on live television on the Today Show with 3 identical triplets. We filmed all day, as you know, in the TV industry, and they wanted each of these identical triplets that were in a very unfortunate fire when they were 18 months old. They were all in the same crib. and they all got horrible third-degree burns. Their mother actually passed away in the fire. But while I was filming this, they were now 18 years old. They wanted every body part, and by the end of the day, the numbing had worn off. And so I did tumescent anesthesia on one of the triplets, and her arm got very edematous because she had poor lymphatic flow. And so I rubbed a medicine called Kenalog on, which is a solution of a steroid, and her scars were about 50% better than her two identical triplet sisters. Same laser, same setting, same injury. So that led to a discovery of laser-assisted drug delivery on scars. And I have a colleague here in Europe, Amaret Herdesal, and she and I have done a lot of work over the last 10 years. She does a lot of the basic science, and then I do a lot of the clinical work, but I've published extensively on putting steroids down the channels, PLLA, which is sculptor down the channels. And so that's been another synergistic, huge advancement in treating scars because it takes less treatments and the patients get better outcomes.
So, can you discuss the presentation of scar tissue across various skin types and any precautions that may need to be taken when administering drugs or when working with specific scars?
Yeah, so the great news about our lasers for scars is they're, for the most part, colorblind. And so we treat all skin types from the fairest redhead to the darkest black skin. There are a couple lasers like the pulse dye laser that you would not use on darker skins, or an IPL for new laser users, because those chromophores are targeting redness, or oxyhemoglobin can interfere with melanin and cause scarring of darker skin types. But all of our fractional lasers can be safely used in skin of color patients, and we routinely do it. At times, you can get some post-inflammatory hyperpigmentation, but actually, ironically, scars are much more forgiving than a cosmetic treatment with a resurfacing laser. So